In today's video, let's have a look at the most common lifestyle disease, diabetes. Diabetes is a chronic metabolic disease that results in too much sugar in circulating bloodstream. Eventually, these high blood sugar levels can lead to disorders of circulatory, nervous, and immune systems. Most common types of diabetes are type 2 diabetes and type 1 diabetes. In type 2, body doesn't produce enough insulin or resist insulin. It is otherwise known as adult onset diabetes. In type 1, pancreas produces little or no insulin. It is otherwise known as juvenile diabetes. Before going to the details, let's see what is the role of insulin and glucose in our body. Glucose is a type of sugar which is the main source of energy for the cells in order to make up muscles and other tissues. Glucose comes from two major sources. One is from breakdown of food and other is from our liver. The excess glucose is stored in liver in the form of glycogen, and the glycogen will release glucose when needed. When our glucose levels are low, such as when we have eaten in a while, the liver breaks down the stored glycogen into glucose to keep the glucose level in a normal range. This glucose is absorbed into bloodstream and then enters the cell with the help of insulin. Insulin is a hormone which is secreted from beta cells of pancreas. Presence of sugar in bloodstream triggers pancreas to secrete insulin. When insulin circulates in bloodstream, it helps the sugar to enter inside the cells. As a result of that, the amount of sugar in bloodstream drops. In response to this drop, pancreas releases less insulin. That means insulin acts as a key to enter sugar into the cell. What happened in type 2 diabetes? Type 2 diabetes occurs as a result of two interrelated problems. First one is pancreas is unable to produce enough insulin. In type 2 DM, instead of moving into the cell, sugar build up in bloodstream. As sugar build up in bloodstream, pancreas need to work more to release more insulin. This overwork causes impairment in pancreatic beta cells and they cannot make enough insulin. Again, sugar buildup in bloodstream. Second thing is insulin resistance. When we feel tired, we eat more food. When we eat more food, blood sugar level rises, which causes high insulin demand. And pancreas produces more insulin, but the cell become resistant to insulin. Without insulin, sugar cannot enter inside the cell. Then what sugar will do? It will store as fat, which causes again tiredness, and we eat more food and the process happen again as a cycle. Let's see what happened in type 1 diabetes. It is an autoimmune disorder. That means our body attack itself by mistake, thereby destroying insulin producing cells. So pancreas is not able to produce insulin. It may be caused by viral infections or pancreatic injury. Any pancreatic trauma or surgical removal of pancreas may result in these conditions. It is more common among children, so it is called juvenile diabetes, but can be occur both in children and adults. Next, we can see symptoms of diabetes. Both type 1 and type 2 have about similar symptoms. Without showing any symptoms, we may live for many years, but when showing, the symptoms are increased thirst, frequent urination, increased hunger, unintended weight loss, fatigue, blurred vision, slow healing sores, frequent infections, numbness or tingling in hands or feet, areas of darkened skin, usually in armpits and neck. If you notice any symptoms or signs, please see your doctor. The exact cause of diabetes is unknown, but there are certain risk factors for developing type 2 diabetes mellitus. In that, first one is weight. Being overweight is a main risk for developing type 2 DM. Next one is fat distribution. Fat distribution in the sense storing fat mainly in your abdomen rather than in your hips or thighs. If you are a man with waist circumference above 40 or a woman with measurement above 35 inches, then you are at great risk. Then inactivity. If you are physically inactive, the use of glucose for energy is minimized. So, the less active you are, the great your risk. Then family history. If one of your close relatives like father, mother or siblings is having type 2 diabetes mellitus, then you are at great risk. Next risk factor is blood lipid levels. If you have low levels of high density lipoprotein, that means low levels of good cholesterol, then you are at great risk. Next is age. After age of 35, risk of developing type 2 DM increases. Next one is prediabetes. Prediabetes means it's a condition in which your blood sugar levels are higher than normal but not enough to be classified as diabetes. But if left untreated, it may progress to type 2 DM. Next is gestational diabetes. When you are pregnant, if you have diabetes, that is called gestational diabetes, then you are at great risk for developing type 2 DM also. Next one is PCOD, polycystic ovarian syndrome. It is a syndrome characterized by irregular menstrual periods, excessive hair growth and obesity, which increases the risk of diabetes. Risk factors for developing type 1 diabetes is not clear, but family history may play a role. It can be occur in any age group, but more common among children and young adults, so it is called juvenile diabetes. Let's learn complications of diabetes. If we are not managing diabetes in a normal way, it will lead to several complications. Among that, first one is heart and blood vessel disease. Since high blood sugar levels leads to fat deposition, I already told you high blood sugars, if there is any insulin resistance, the sugar will stored as fat. So this fat deposition causes narrowing of blood vessels. That means the normal blood flow get interrupted. It will lead to various heart diseases like heart failure, cardiac arrhythmias, atherosclerotic heart disease, etc. And also there is interruption in blood flow towards brain. It will result in stroke. Since the blood is thick, it is not flowing in a normal way. There occurs a high pressure against the walls of arteries. That is high blood pressure. As a result of arteries become narrowed and blood flow decreases, it results in arteriosclerosis. Next one is diabetic neuropathy. When diabetes affects nerves, it is called diabetic neuropathy. Like every organs, nerves are also supplied by blood vessels. When the blood vessels diseased by high blood sugar levels, nerve damage occurs, which results in tingling, numbness, burning, pain, or eventual loss of feeling usually begins at the tip of toes and gradually spreads upwards. Diabetes may lead to kidney disease or irreversible damage to kidney, which may require dialysis or kidney transplant. Another complication is diabetic retinopathy. What is diabetic retinopathy? Diabetic retinopathy is caused by damage to blood vessels in retina. Other serious eye diseases like cataract, glaucoma, etc. also can be occur as a result of poorly controlled diabetes. Diabetes may also lead to various skin complications including bacterial and viral infections, cellulitis, etc. Another serious complication is Alzheimer's disease. It is a type of dementia characterized by progressive loss of memory and disruption in several other mental functions. How we can prevent diabetes? By choosing healthy lifestyle practices. Even if we are diagnosed with prediabetes, if we are living in a healthy lifestyle practice, we can stop the progression to diabetes. The healthy lifestyle practices include eating healthy food like fruits, vegetables, and whole grains, which is low in fat and calories and high in fiber. Then we should active aerobic exercises like walking, bicycling, running, swimming, etc. we can choose in order to prevent diabetes. If we are diagnosed with pre-diabetes, try to lose our body weight up to 7 to 10 percentage, which will reduce risk of diabetes. Then we should avoid inactivity for long periods. We may sit for a long period, but it will increases the risk of type 2 diabetes. So try to get up every 30 minutes and move around for at least few minutes to avoid developing type 2 DM. Let's see treatment of type 1 and type 2 diabetes. In type 1 diabetes, there is no insulin production or there is little insulin production. So, artificially insulin should be supplied. So, artificial insulin is the first line of choice. In people with type 1 diabetes, there should close monitoring of blood sugar levels. Insulin can be administered by means of insulin needle, pump, or insulin pen. One of the latest intervention in the treatment of type 1 diabetes is introduction of artificial pancreas in order to control blood sugar levels. In type 2 diabetes, oral medications alone can be given like metformin or combination of oral medications plus insulin can be given as a treatment. Let's have a look at today's portion. There are two types of diabetes, type 1 and type 2 diabetes. In type 1 diabetes, pancreas produces little or no insulin due to autoimmune response. In type 2, it occurs as a result of two interrelated problems, that is insufficient amount of insulin or insulin resistance. Type 1 is otherwise known as juvenile diabetes because it is more commonly occur in children and young adults, and type 2 diabetes is called adult onset diabetes because it is more commonly occur in older population. But both type 1 and type 2 can be occur in both populations. Prevention is better than cure. So practice healthy lifestyle to prevent diabetes. If you found this video helpful, please do like, comment, share and subscribe my channel Knowledge Masters.